You've probably heard the word lupus, but what does it actually mean? How can someone look fine one day and the next day feel exhausted, in pain, and unable to get out of bed? In this video, the narrator guides you through a clear, medical, but easy-to-follow explanation of lupus, using imagery of cells, organs, and daily life to make a complex disease feel understandable and human. Lupus is a chronic autoimmune disease. Chronic means it tends to last for years, often for life. Autoimmune means the immune system, which is supposed to defend you from infections, starts attacking your own tissues instead. The most common type is systemic lupus erythematosus, or SLE, where many organs can be involved: skin, joints, kidneys, blood, brain, lungs, heart, and more. It is not contagious, it is not cancer, and it is not the patient's fault. Normally, your immune system can tell the difference between self and enemy. In lupus, that recognition system breaks down. Immune cells, especially certain B cells, start making autoantibodies, antibodies that target the body's own components, often parts of the cell nucleus. These autoantibodies can bind to their targets and form immune complexes. Those complexes can get deposited in tissues like the skin, kidneys, joints, and blood vessels. The complement system and other inflammatory pathways get activated. The result? Inflammation, swelling, pain, and gradual damage in whatever organ is targeted. Who gets lupus? Lupus can affect anyone, but it has a clear pattern. It is much more common in women, especially between the teenage years and middle age. It is also more frequent and often more severe in certain ethnic groups, including Black, Hispanic, Asian, and Native American communities. In the United States, hundreds of thousands of people are living with lupus, many of them young women balancing work, family, and chronic illness at the same time. Lupus doesn't look the same in every person, which is one reason it can be hard to diagnose. Common features include extreme fatigue that sleep doesn't fully fix, joint pain and stiffness, often in the hands, wrists, or knees, skin rashes, especially a butterfly-shaped rash on the cheeks and nose, or rashes made worse by sunlight, mouth or nose ulcers, hair loss or thinning hair, fever, weight changes, or feeling generally unwell. When internal organs are involved, things can get more serious. Kidney involvement, lupus nephritis, can cause swelling in the legs, foamy urine, high blood pressure, and abnormal urine tests. Lung or heart involvement can cause chest pain, shortness of breath, or fluid around the lungs or heart. Blood involvement can cause anemia, low white cells, or low platelets. Brain and nervous system involvement can lead to seizures, confusion, mood changes, or other neurological problems. Lupus often comes in flares and remissions, periods when symptoms worsen, then settle down again. This unpredictability is one of the most difficult parts of the disease. There is no single cause of lupus. It's usually a combination of genetic, hormonal, and environmental factors. Genetics. Some people are born with genes that make their immune system more likely to overreact or misfire. Hormones. The strong female predominance suggests that hormones like estrogen play a role. Environment. Triggers can include sunlight, UV exposure, certain infections, smoking, stress, and some medications in rare drug-induced lupus. But even with all this research, we still cannot predict exactly who will develop lupus. It is not caused by something simple like bad lifestyle or weak immunity. Diagnosis. There is no single lupus test. Diagnosis is based on a combination of detailed history and physical examination, blood and urine tests, and sometimes imaging and biopsy, especially of the kidney or skin. Important lab findings often include ANA, anti-nuclear antibody. This is positive in most people with lupus, but it can also be positive in other conditions, so it's not specific by itself. More specific antibodies such as anti-double-stranded DNA, anti-dsDNA, and anti-Smith can strongly support the diagnosis. Complement levels, C3, C4, may be low during active disease, especially with kidney involvement. Urinalysis can show protein or blood when the kidneys are affected. Treatment. There is no permanent cure yet, but lupus is treatable, and many people live long, meaningful lives with it. Treatment focuses on calming the immune system, preventing organ damage, and reducing symptoms to improve quality of life. Common treatments include hydroxychloroquine, NSAIDs, corticosteroids, immunosuppressants like azathioprine or mycophenolate, and biologic therapies such as belimumab. Treatment plans are highly individual. The same label lupus can mean very different strategies for different people. Animated medicine bottles and supportive care scenes emphasize partnership between patient and clinician. Lupus is not just a physical disease, it affects emotions, work, relationships, and identity. Many people live with chronic fatigue, unpredictable flares, depression, anxiety, sleep problems, and fears about the future. Good lupus care looks at the whole person, not just lab tests. Helpful strategies often include protecting the skin from sunlight with clothing and sunscreen, following an anti-inflammatory lifestyle, balanced diet, not smoking, staying active as tolerated, regular medical follow-up, screening for mental health issues, and planning carefully for pregnancy with specialists. Lupus is not just being tired, and it's not all in someone's head. It is a complex autoimmune disease where the immune system loses its way and attacks the body it's supposed to protect. But with modern treatments, careful monitoring, and attention to mental as well as physical health, many people with lupus are studying, working, raising families, and building full lives. Understanding what lupus really is and what it is not is the first step to supporting anyone who lives with it or to taking better care of yourself if you do.